Good morning. It's Thursday, July 16, 2026. We're here at Duke Spine Institute streaming live spine surgery. Our patient comes from Florida, Ormond Beach. He has back pain, but his back pain is coming from a tear within a muscle in his buttock called Piriformis syndrome. Once the muscle's torn, which happens when you bend over improperly, you're going to end up getting inflammation in the muscle that never goes away. That inflammation is what causes the pain in the muscle. Let's show the audience what I'm talking about as we get started. Show them the video.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Deukmedjian release. From there, the piriformis pain is permanently eliminated. The advantages with the Deukmedjian release is that it's an outpatient procedure, which would take up to about 30 minutes. Minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
John? All right, you can see from our video that the piriformis muscle can be torn. Once it is torn, based on our experience of dealing with this for many, many years, we can do shots, we can do physical therapy, we can do Botox. There's many things that can be done, but none of them work and none of them give lasting relief. People come back, they still have the same pain in their buttock, and it never goes away. Because the sciatic nerve is so close to the piriformis muscle, it's quite likely too that you can get sciatic pain down your leg from the piriformis muscle being torn. Any questions?
No questions.
You can actually see the piriformis muscle in this x-ray, yeah, right there. And that's what we're releasing. We're releasing the piriformis muscle from its attachments, and not the entire muscle, but mostly just the scar tissue within the muscle, from its attachments to the greater trochanter. Any questions?
No questions.
Sean? I can feel the scar tissue as I'm doing the procedure within his muscle. It's extremely dense. One of the worst I've ever seen. The procedure is done with a 10 millimeter incision. Shot. This 10 millimeter incision is all that's needed for an ultra minimally invasive treatment to get rid of his piriformis syndrome permanently, by the way. Once the piriformis muscle is released, the pain doesn't come back. Sean? Not in the piriformis muscle. And again, as I said, there's an awful lot of scar tissue I'm feeling here. How's he doing? Good?
Yes.
Our patient's asleep for this. We do these procedures under twilight sedation. Twilight is very safe for this type of procedure for most patients. All right, just about done. Again, as I said, I've encountered a lot more scar tissue, very deep, which makes the procedure a little bit more challenging, but I feel good about it. I think that should be good. I want to show you the incision. Take a look at this. Anthony, you see this incision?
Yes, I do.
There's almost no bleeding. The incision is just 4 millimeters, tiny, and as long as we keep his blood pressure under good control, there'll be no bleeding and minimal to no pain after surgery. All right, 2 little staples. We get them out the next day. Thank you. We're almost done. Any questions from the audience?
Yes, we have a question from Lioness on YouTube.
Hello, Lioness on YouTube. Thanks for joining us. Happy to take your question. Sean?
How do you know it's torn completely?
That's a great question. The answer really is, are you guys good with the knee and everything shot? That's perfect right there. Lioness, we don't need to know if the muscle's torn completely. We just need to know if the muscle is causing pain. So the diagnosis is a clinical diagnosis. We use something called the Deuk spine exam to diagnose people's back pain, the source of their back pain. In his case, he didn't have any pain coming from his spine at all. It was all coming from his butt cheeks. And if the pain is in the top of the butt cheeks, it's usually the piriformis muscle causing that pain. If it's in the bottom of the butt cheeks, it's the ischial tuberosity tendonitis. Basically, the hamstring muscle is... I just need about another minute. How's he doing? Good? So it's a clinical diagnosis. And based on the clinical diagnosis, we recommend treatment. Sean? The treatment we recommend is what you're watching right now, which is our Deuk Piriformis release. This is a patented, ultra-minimally invasive treatment. It was developed by me, Dr. Deukmedjian, the CEO and founder. The reason I developed this treatment was because open piriformis release is a bloody mess, and patients are in pain for months and months. And the open piriformis release doesn't work in half the patients. This surgery has worked in 100% of our patients. Every single one of them, the piriformis pain is gone. And it's all done without bleeding, without hospital, and without pain medication. It's done with a 4 millimeter incision. Take a look at this incision, Lioness. Right here, 4 millimeters, no bleeding, literally 1 drop of blood. So that's compared to the open piriformis release, which is done, I'll show you. Give me a marker. The open piriformis release most surgeons will do is a cut like this. Okay, from here to here. This is a good 7 inches. And when they cut you, they cut through your skin, they cut through your muscle, they cut through your gluteus maximus muscle, your gluteus minimus, your gluteus medius. Then they get hopefully to your piriformis, and you've got these obturator muscles just below it. A lot of surgeons damage the sciatic nerve accidentally, and the patient loses function in the leg. So I developed a brand new way of doing this, totally minimally invasive, 4 millimeter incision, no bleeding, no hospital, outpatient, no restrictions afterwards. Our success rate has been 100%. Elimination of piriformis pain. You can't beat it. No bleeding, no complications, no hospital, and 100%. So we found the best way to do this, and that's why we do it this way. Some doctors will do a diagnostic block of the piriformis where they inject the piriformis muscle before the procedure. I don't think that's necessary in most patients because it's pretty easy to diagnose clinically. And we do it with our Deuk spine exam, which is a proprietary physical exam combined with our experience and knowledge and numbers, data. along with MRI findings and a history. All right, any other questions?
Yes, we have a question from Lanu on YouTube.
Uh-huh.
Some of my medical associates believe herniation can trigger depression. What is your view on this?
I could not hear your question. Can you guys keep it down for just a minute, please? Go ahead, one more time.
Some of my medical associates believe herniation can trigger depression. What's your view on this?
Yes. That's a great question, Lanu. Thanks for asking. Lanu, I agree that herniated discs can trigger depression, but only because they cause symptoms. Remember, Lanu, the vast majority of herniated discs in your back and your neck are without any symptoms at all. No pain, no weakness in the arm, no weakness in the leg, no numbness in the leg, no numbness in the foot, no tingling, no sciatica. So if you have a herniated disc in your back or your neck, but you have no pain at all and no weakness, numbness, or tingling, then I don't believe a herniated disc will cause depression. I think it only causes depression when it limits people's lifestyle because the active lifestyle exacerbates pain, or it causes depression when you're treating the pain from a herniated disc with substances like alcohol, narcotics, muscle relaxers, psychotropic drugs. So basically, it's either the symptoms of a herniated disc or the treatment by the patient and doctor with medication or drugs that would cause depression. Okay? And it's also the patient's life is limited by a herniated disc because they don't want to exacerbate the pain. But if the disc is asymptomatic and people can do whatever they want, I don't think it causes depression. Any other questions?
No questions.
Thanks everyone for joining us. We'll be back shortly with our next patient who's having facet pain in the lower back on the right side, L45, L5S1, and sacroiliac joint pain on the right side. We'll be doing a Deukmedjian rhizotomy, right SI, right L45, L5S1 facet. Good? And good morning, I'm Dr. Deukmedjian. I'm here with one of my lovely patients who she had some words of wisdom for me this morning. Keep smiling. And you're smiling a lot today.
I am out of pain.
Out of pain, good. So she had a piriformis muscle release done. How do you feel?
Good for morning after.
Yeah,
Good.
feel good.
Ready
And
to go.
can you tell if that piriformis pain is gone or is it still there?
It's gone. It's just from the pressure from the surgery, but I'm good to go.
Yeah, everybody has a little discomfort from the
Yeah,
surgery,
I understand that,
you can
yeah.
tell the piriformis pain is gone.
Yes.
Congratulations. We
Yeah.
did it with minimally invasive, 4 millimeter little cut on the back of your hip there. And we just go in with our probe and we cut up the scar tissue that's, causing all the pain, release the muscle, and that causes the pain to go away right away. So what was life like for you before when you still had this horrible pain?
Very restrictive. I wasn't walking. PT, wasn't even helping. And the injections, that was ongoing with Dr. Patel for a while. But I hope to get back to life.
That's it.
No pain. That's the biggest thing. That takes too much out of you. It's not a way to live.
A life in pain is
Yeah.
not good. Or
And I was
afraid of,
miserable. I was making everybody miserable.
or fear of pain, by doing
Yeah.
something to set it off.
Yeah.
Now the pain you had in your buttock, this piriformis pain,
Uh-huh.
was it constant or did it kind of get worse with certain activity?
It got worse during the day. The
Yeah.
more you did, and you just have to back off. I did ice and heat, and Dr. Patel did the injections, and it's just some, not immediate relief, but, I got some, but no, yesterday was a good thing.
Now you're a dog lover, right? And you have a new puppy, you told me.
Yes, I have a little mini schnauzer, Darby, so
Darby.
now I can go with her. I can run and pick her up.
And that's it. Picking up is key because when you bend over to pick something up from the ground like a little dog, it usually aggravates the pain from the piriformis in the buttock. All right, so anything else you want to share with your viewers and fans out there?
don't let it go. Get help, come to the clinic, and enjoy life now. I really will.
Congratulations, you took
Thank
the leap
you.
of faith and you got it done. Go enjoy life.
Have a glass of wine on me.
Right. Sounds good. Let's get you out of here.